Dear chairmen, dear Professor Kotsis, ladies and gentlemen, so in this brief overview about arterial stiffness, dyslipidemia, and statin therapy, 15 seconds, it's a TikTok format, but it will be 5 minutes, and I'm 15 years older than him, so I'm above 31. So greetings from Croatian Hypertension League and also from Croatian Atherosclerosis Society. I think because I do lipids for the last 20 years, it's a very important topic, and we all agree on this. So what is the arterial stiffness? Just in brief, reduced arterial compliance measured by pulse wave velocity, we know all that. And the main problem is that when the arteries are stiff, and they are for sure, it's elevated systolic pulse pressure, it's lower diastolic flow, and at the end, at the target organs, there is like a hit, there is a shock, and one of the pathogenic mechanisms is activation of renin-angiotensin system, and as a result, fibrosis. And fibrosis is irreversible, and you have a target organ damage. So it's very well known, almost 25 years. So, and you see this pivotal, I think, study that the aortic stiffness predict all-cause and cardiovascular mortality. And also our colleague and friend, Professor Vlahopoulos, 15 years ago, published that values above 10 meters per second are a strong marker for vascular risk. And also as well one study from 2012 that you can see here, that increase in brachial ankle elasticity index by 1 meter per second means increase in 12% of total cardiovascular events, 13% of cardiovascular mortality, and 6% of all-cause mortality. And all those data are very reproducible till date. So what is the pathophysiology of arterial stiffness? It's quite complex, but here you see the sodium intake and also the lipids. So I will show you the one sphere, how the lipids, how the dyslipidemia can cause the arterial stiffness. Because to be honest, all the mechanisms that are included, that are aggravated in process of arteriosclerosis, also like the activation of metalloproteinase, the tumor necrosis factor alpha, oxidase to LDL cholesterol, interleukin. As you can see here, the mechanisms are very, very similar, and the matrix metalloproteinases affect collagen and elastin balance and are regulated by various activators, as you can see here. So at the end, what causes arterial stiffness? Inflammation, low elastin, high collagen, calcifications, endothelial dysfunction for sure, stiffness of vascular smooth muscle cells, and all those things we see in dyslipidemia, and all those things we see in arteriosclerosis. So we know that LDL cholesterol has cytotoxic effects on the endothelial cells and also on the secretion of adhesion molecules, platelet aggregation, monocyte adhesion, enhanced foam cell formation, triglycerides as well, as you can see here, and everything, all this cascade ends up with increased arterial stiffness in dyslipidemia, because the LDL cholesterol suppress endothelial nitric oxide production, also alterate the antithrombotic properties of vascular endothelium, also enhance expression of adhesion molecules for inflammatory cells, and at the end, the affinity for scavenger receptors on inflammatory cells. At the end, with these mechanisms, also we have increased vascular stiffness. So this is one scheme that shows the pathophysiology of atherosclerosis, and you will agree with me that all those processes here that I named that develop atherosclerotic plaque also are all the processes that also develop the arterial stiffness. So the statins, what are the statins? We know that they are invented almost 40 years ago, I think, and their main mechanism is to inhibit this enzyme, hydroxymethylglutarate coenzyme reductase. They lower the level of cholesterol into the hepatocyte. You have upregulation of LDL cholesterol receptor, and you have a better clearance from the blood of the LDL cholesterol. But also, beside the lipid-lowering effect, statins have pleiotropic effect. They lower the C-reactive protein level. They elevate the endothelial nitric oxide synthetase, and they stabilize the plaque. What does it mean? It means that they empty the plaque from the cholesterol, but also they form a much more stable plaque, calcification of a plaque, as you can see here. And the pleiotropic effect, very important, driven by statin, is the anti-inflammatory effect. All this can influence in the reducing of arterial stiffness. And this is shown for the first time, I think, almost 20 years ago. This is one study that showed that rosuvastatin reduced pulse wave velocity after 6 months, and also lots of meta-analysis. Again, colleague Vlahopoulos For example, in 2010, the statin improved arterial compliance with mechanisms that are yet to be determined, but we know today that it is elevating the nitric oxide, lowering the inflammation, and also lowering the activity of metalloproteinase activity. And I had the opportunity almost 10 years ago to be part of one working group, one big meta-analysis, where we found out that the statin therapy has the effect on augmentation index. Of course, lowering the LDL cholesterol, but also has a beneficial effect beside lipid lowering effect, pointing out on pleiotropic effect. But that's not only the statin, it is very clearly shown also for ezetimibe, but also for the novel therapies like PCSK9 inhibitor, where you can see here that this meta-analysis, I think it was 1 year ago, provides robust evidence that adding PCSK9 to lipid-lowering interventions significantly improve arterial stiffness, indicate broader vascular benefits beyond LDL cholesterol reduction. So, in summary, dear colleagues, ladies and gentlemen, Mr. Chairman, so arterial stiffness is independent cardiovascular risk marker. Dyslipidemia for sure worsens vascular aging. Statins do improve both lipid profile and vascular health. We have to start to treat dyslipidemia as early as possible and go as low as possible. When I say that, I'm not an evil witch giving a statin, because we have, well, just to point how this picture was made. I asked the artificial intelligence to draw me a picture of a physician prescribing statin. So this is the way how artificial intelligence thinking, that we are the evil witches giving the poisoned apple. We know that the statins are safe and effective drugs, and just at the end, and my last thought is that when we are born, the LDL cholesterol from our cord blood is about 0.6 till 1.0 millimoles per liter. So to be honest, we have to treat the dyslipidemia, and we should go as early as possible and as low as possible. Thank you very much for your attention.